So in here, we'll just actually look at what examples of disorders for blood cell proliferation. And talking about the disorders for blood cell proliferation, we're basically looking at what some disease conditions that will actually stop blood cell production, or some conditions that will basically what increase blood cell production too much. Okay, so we'll look at them. I think I just have like 3 here, okay, which is actually enough for this purpose. So the first one, we have leukemia, right? Under the disorders of blood cell production, we say that these leukemias, they're actually a group of cancers of the blood forming tissues and cells. Okay, so leukemia is a cancer of the body's blood forming tissues, including the bone marrow and the lymphatic system. Okay, pay attention for these last lines of leukemia. We say that many types of leukemia exist. Some forms of leukemia are most common in what children. Now, other forms of leukemia occur mostly in what adults. Leukemia usually involves white blood cells. Okay, so leukemia is an example of what a disorder of blood cell proliferation. Then next, we're looking at polycythemia, right, where there's elevated production. Okay, so now we say that there's a non-what cancerous overproduction of red blood cell. We call this polycythemia. All right. Now, if there's an increased production of what platelets, we call it what thrombocytosis. That's overproduction of what thrombocytes. Okay, and this may be pre-malignant. That's basically what it is, going towards acquiring cancer levels. Okay, then we have the last one, which is basically what the myelodysplastic syndrome. Okay, myelodysplastic syndrome involves ineffective production of one or more cell lines. So this one can occur to any type of what blood cells. It could affect what red blood cells, where you are having fewer or poorer quality cells. It could affect white blood cells, where you're having fewer or poorer what quality cells. It could also affect platelets. If it affect red blood cells, it can lead to things like what anemia. You could have a pale skin. You could have weakness or tiredness. You could have difficulty trying to breathe. If you affect white blood cells, you have frequent infections. That's because your immune system is suppressed or weak. Okay, if you affect platelets, platelets are involved in what do they call it? Blood clotting. Okay, so platelets are involved in blood clotting, so you easily be bruised or there'll be easy bleeding. Okay, so that's it about what the disorders of what blood cell proliferation. See you guys pretty soon.